All right. Hi, everyone. Welcome to Silent Podcast. I'm Christina Lachelle.
And I am Ijama as an A.
And this is our first time going live with Silent Podcast. We are excited to come back. It's been a while since we've done a podcast, but we've been thinking about you. And we thought there was no better time to come back and have this conversation about sickle cell and mental health than during Sickle Cell Awareness Month, which is September. So, welcome and thank you so much for joining us.
Awesome. So, one of the things that we do during our podcast is we share a voice of truth, which is a quote that I feel really represents the conversation that we're going to have. So, one of the quotes that I really love that I usually share in regards to the Ruby Ball is in regards to people living with sickle cell is sometimes the strongest amongst us are those that cry through silent tears. Sometimes the strongest amongst us are the ones who smile through silent pain and cry behind closed doors and fight battles that nobody knows about. And so, one of the things that we wanted to touch on when we talk about people crying behind closed doors and really coming off and, like, you know what I mean, being trying to hold and be strong is that dichotomy between sickle cell and mental health. And we talk about the pain and how the pain impacts those individuals living with sickle cell. But one of the things that we don't talk about a lot is how it impacts individuals mentally and emotionally. And so that's what we want to get into with our conversation today with our amazing panelists.
Yeah. And I think a caveat that we definitely want to be very clear about is that just because someone has sickle cell does not mean that they have some sort of mental illness or, it doesn't mean that something is wrong with them. But there are some hard and true facts that let us know that, like, having a chronic illness such as sickle cell or any other, chronic illness really puts you at more of a susceptibility to having mental health issues. So I just want to share a couple of stats with you. According to the Canadian Mental Health Association, mental health and physical health are fundamentally linked. People living with a serious mental illness are at a higher risk of experiencing a wide range of chronic physical conditions. And people who are living with a chronic physical health conditions experience depression and anxiety at twice the rate of the general population. And then the National Institute of Health says that people of all ages with depression are at a higher risk of developing certain physical illnesses. So people with depression have an increased risk of cardiovascular disease, diabetes, stroke, pain, and Alzheimer's disease. And that's without, having the chronic illness. It's just depression itself. So we thought that it was super important to really talk about the impact that mental health has on sickle cell, because sickle cell in itself is such a debilitating disease. And then coupling that with mental health concerns, it can be chronic. So we have an amazing panel for you all today that we want to introduce. And so I'll go ahead and get into that. Is there anything you wanted to say before we introduce our guests?
Nope, let's get into it.
All right, let's do it. All right, so our first guest that I would like to introduce is Erica Smith. Erica is a native of North Carolina and a clinical social worker and therapist who specializes in trauma with a special focus on serving those who have experienced interpersonal violence, racial trauma, and or are living with chronic illnesses. And many of these specializations come out of Erica's own lived experiences. In 2003, Erica was 12 and initially diagnosed with rheumatoid arthritis before being hospitalized for the first time. And then later that year, she was diagnosed with lupus before numerous tests, specialist appointments, and hospitalizations. She has now lived with lupus for more than 19 years. And from those circumstances and more, Erica's heart for serving people was strengthened and initially led her to volunteering internationally and then nonprofit work before becoming a therapist. She loves her work as a therapist and has worked as a social worker for 10 years. And outside of her role of a therapist, trainer, and clinical supervisor, Erica is a highly caffeinated woman who loves to travel and spend her time with family, friends, and her dog, Toast. So let's welcome Erica.
Hi, thanks so much for having me. I'm so happy to be here.
Awesome. Thanks, Erica.
Okay, our next panelist is someone who is not a stranger to the podcast. And we had her on and we promised we would bring her back, Maya Bloomberg. Maya Bloomberg is a board certified family nurse practitioner at Sylvester Comprehensive Cancer Center in Jackson Memorial Hospital. She earned both her bachelor's and master's of science in nursing degrees from University of Miami. She's worked as a hematology nurse practitioner for almost 8 years, specializing in sickle cell and bleeding disorders, which shed light on the significant health and racial disparities that exist in modern medicine. This led her to create a social media page at the Heme NP, and she'll tell you more about that later, devoted to providing reliable information to sickle cell patients so they can better advocate for their health with hopes of bridging disparity. So let's go ahead and welcome Maya Bloomberg.
Hi, everyone.
Hi, welcome.
Thanks for having me back. It's going to be a great convo tonight.
Definitely.
Yeah, we're excited. Thanks for coming. Okay, our next guest is Jerry Wilcory. He is a man living with sickle cell, a man of many talents. He is an avid warrior and patient advocate to the community with the greater Houston area. Since receiving his bachelor's in business management in 2015, Jerry has been entrenched in Houston as a member of both a traditional social club, the Umo Igbo Unite, and a board member of the community-based organization Sickle Cell Association of Houston, playing the role as a bridge builder between his roots and the blood disorder. In 2019, he was recognized for his efforts in assisting the legislation of 4 Texas bills supporting the advocacy for sickle cell. He's the older of 2 siblings diagnosed with sickle cell anemia, SS, and he's very intentional about the belief that we cannot wait for somebody else to do what we are capable of doing. In essence, we have to be the change we want to see in our community. When Jerry's not representing the community actively, he's representing us visually. And he wants you to know that, ladies, he's a high fashion man with a strong suit game. So watch out now. Let's go ahead and welcome Jerry to the panel.
What's up? Hey, Jerry.
Thank y'all for having me. It's a pleasure to be with y'all.
We appreciate you. And some background on Jerry. When we first started the Ruby Ball, Jerry was one of the people that really helped us out. We did a conversation that shed light on sickle cell as we were trying to get people to truly understand our mission and our goals when we were first going into doing the Ruby Ball gala that we did in 2017. And so that's when I was first introduced to Jerry by one of his friends, Brianna. She was like, you have to connect with Jerry for this initiative. And I'm so glad that she connected us. So thank you for taking the time to be on this podcast today.
It's been awesome. It's been awesome to follow you, Joma. I'm so happy and I appreciate the opportunity to come back here and to continue to talk about sickle cell disease. So thank you.
Appreciate it.
Welcome, welcome, welcome. Okay, our next guest is Amoke Ogar. Amoke Ogar, and she's the founder of Sparkle for Sickle Cell Foundation. She's a sickle cell advocate and warrior, and a budding career as an interior designer, sharing her story on social media platforms to raise awareness. She's a sickle cell conversation starter. She likes for warriors to get comfortable with having the tough conversations. She also encourages warriors to help families and loved ones to understand them better while building their community. Let's welcome Amoke Ogar.
Awesome.
Hi, everyone.
And I want y'all to thank Amoke because she is in Nigeria right now. So we are thankful for her taking the time to be on this conversation because it's way past her bedtime. But we are joining us here in the States, in the United States, to be able to have this conversation. But yeah, when I saw okay, she really is a voice for individuals with sickle cell, and she is a change maker because if y'all not already following her on Instagram, you need to follow her on Instagram because the reels that she shares really does help us to better have a voice and to people to see us from a different perspective.
All right. Welcome, welcome, welcome. And last but not least, we have Elle Cole. And Elle Cole is a mom of twin daughters, one of whom is living with sickle cell anemia. She serves as a health advocate for sickle cell disease and type 1 diabetes. She's an ambassador for St. Jude's Children's Research Hospital, and she raises awareness about sickle cell disorders to help make the quality of life for people living with the genetic disorders and autoimmune diseases better. Let's welcome Elle.
Hello, everybody. Thank you.
Hi. And so same thing, Elle. I first got introduced to Elle when I was doing the Ruby Ball Gala back in 2018. And so she has been an advocate of ours ever since then. And so I just love to see all the great things that she's doing, from her children's book, like how she advocates for the children's voice. And so I'm so excited to have her on this podcast representing the voice of the parent of sickle cell children.
Yeah, I mean, a lot of times you don't hear from the caregivers. You hear from people living with sickle cell. You hear from people that are healthcare providers to people with sickle cell, but we don't always hear from the caregivers. And there's definitely a story there too. So we appreciate you joining us today.
Thank you.
All right.
So
we're warmed up.
Yep. So let's go ahead and get into it, because I know we don't want to hold y'all for too long. So the first question that we usually ask our podcast guest is, what is one word that you would use to describe your journey with sickle cell or chronic disease for this particular podcast from a mental health perspective? So let's go ahead and I'll start. Who wants to?
I'll go. So I feel like we're in school and waiting for a teacher to call on us. Just from a healthcare provider perspective, I think it's completely unpredictable. I think with sickle cell and with many chronic illnesses, it's characterized by unpredictable flare-ups. You can be doing everything right and still have a flare-up. And I think that aspect of doing everything right and the unpredictability can have a huge impact on mental health, especially for warriors living with sickle cell or any chronic illness. And I think it's important to kind of focus on what you can and can't control in that process, to not let the unpredictability have a negative effect on your physical health. But I think when it comes to chronic illness, unpredictability, I think, is just such a big word for a journey for somebody living with one.
Definitely. I like that. Who wants to go next?
I can go, and I'm going to apologize because it is storming like chaos here. So if I need to talk louder, I can. Mine is actually hope. And I think that comes from me living with chronic illness and being pretty sick often growing up. And I think, and then turning into someone who grew up to be a therapist, it's like if I didn't have that word in my own personal journey, in addition to, because Maya is so right. It is so unpredictable. But if I didn't have this hope, I honestly am not sure I would still be here today, frankly. And so that is actually, I have a tattoo that says hope too. So I'm pretty committed to the word, but yeah, that's probably mine.
I'll go next. So for me, my word is courage. And I chose courage because on this journey, I realized you can't be silent and just sit back. You have to speak up for others who can't always speak up for themselves. For me, that could be my child. And you have to often be willing to be yourself, even if you're afraid. Be willing to stand in the gap for someone else as an advocate, as a parent, as a caregiver, as a loved one. And so courage is my word because I have to take it everywhere I go.
Awesome.
Courage. Love that.
So I'm going to go next. So my word, I feel like before today, my word would have been something else. But I just went through a really rough patch for a really long time, still trying to come out of it. So my word for today will be emerging. And that's because when you think you have it figured out, it's gonna roll again. And the thing is just learning to roll with the punches and know that you will always be thrown down, but you're always allowed to come up for air, always allowed to rebuild, re-strategize, and go again. Because that's the only other option. It's like the other option is giving up, and we know that's not a choice, not for me anyway. So my word is emerging.
I love it. I love it. So that leaves us with Jerry.
All right. So to kind of wrap up what all the ladies have said, I believe my word would have been perseverance. Definitely, it's almost a culmination of all the words that we've just heard. Uh, Dealing with sickle cell as a child till now, I've had to overcome a lot of things, a lot of limitations, a lot of doubts, a lot of pain. So every day you just kind of understand to even push through. You always got to push through. Don't allow yourself to be limited. Sickle cell is not the end all. There's still a lot that an individual or a warrior can achieve through this blood disorder. So the word persevere.
I love it.
Awesome.
Great words. You remember those words? We're gonna come back
to them. I
Okay,
remember all of them.
So thank you all so much for, those are kind of, I read your bios, but those words really introduced who you are, and they gave us some more insight about you. So now what we're going to do, I'm going to go into a little bit more of a discussion to talk about the impacts of mental health on sickle cell disease or chronic disease. And Jerry, you're the last one standing, and we're going to start with you. There's so many societal pressures as a man to be strong and to be, to have, to not feel pain or to not show pain or things like that. And I would love to hear from you as a man living with sickle cell about how do the societal pressures placed on you or on men in general impact the way that you're able to show up as someone living with a chronic disease?
Well, thank you for that question, Christina. That definitely was the basis of my initial answer when I spoke about perseverance. Simply just because there is a societal image of the man and the woman, and of course how the man is supposed to protect the home, supposed to provide for the home. So of course that image is already implanted in our society. And so for me, I have to always kind of understand that it. I've had a woman who's been willing or asking me to please be a little bit, more compassionate or show feelings of any type of sense when it comes to my sickle cell or how I feel. But I have to understand that, look, at the end of the day, we're not going to stop because I'm in pain or whatnot. We still have things that have to get done. I still need to be able to provide for the home. I still need to be able to provide for you. I still want to be able to provide for this family. So it's always a stigma inside of the back of my head, but it's not something that literally, breaks me down. I actually use it as motivation to continue to keep pushing, because I still feel as if, with sickle cell, if I'm able to overcome my occasional unpredictable pain crisis, I think that makes me a stronger man than, a lot of other men who simply can go days without pain unless they actually get into legitimate accidents of that nature. So I kind of use it to help, push myself, like, you're just as strong as the next man, or you're just as strong as your peer, in the sense that you're not weaker because you're overcoming something that they're not even expecting to happen. It can just happen in a twinkle of an eye. And somewhere I have to show the most restraint and the most strength in the same situation when it comes to my pain crisis.
And does showing that strength ever kind of take a toll on your mental health? And if so, how does that?
It has times. I've had a little bit of times of depression, just kind of where I'm to myself and I'm just kind of thinking, like, is it really all worth it? Like, what are we doing here? And so sometimes you have those little breakdowns, but I still I usually like to take time to sleep, relax whenever I'm in my pain crisis. So that's kind of the best time. If I can rest, I can get through it. There's a lot of emotions that can just flush through my mind and just flush out. And then when I wake up, it's just like, okay, we overcame that situation. So that's my little getaway when it comes to those kind of those mentalities or those ideas coming into my mind, and trying to avoid allowing that to hold me down.
Yeah, that's great. And so just even piggybacking off of that, coming to you, I'm okay, just seeing from a perspective, also individual living with sickle cell, would you say that there's ever been a point where you felt that you almost wanted to give up? Because I know that you said what gets you through, or one of your words is emerging. So do you have a story or a point in your life where you may have felt that this is too much, you know what I mean, for me? And how did you deal with that? And if you could elaborate on that a little bit.
Yeah, thank you for the question. So I would say hearing Jerry talk about it in the sense that what is expected of a man, then it's like you were brought up learning, oh, a woman is supposed to rely on a man, right? A woman is supposed to be gentle, be soft, allow yourself to be taken care of and helped. But then growing up and everyone is like, you're too weak, you can't do this, then you just have this. I had this like mental reset where it's like, if he can do it, I can do it. So now I don't know how that has played out in the years, but growing up, I didn't want to hear you can't. So it was always a struggle. Mom, let me try. My dad would be like, do this, do that. And it was like at 13, I was going on exchange programs to another country by myself without my parents. And I was discovering that there were capabilities right somewhere in there, and I just kept pushing for it, just kept discovering. I was the child who didn't want to live at home with my parents, so once I could go far away, I was like, bye, because I just didn't want to be 30 and like I needed my mom. And it's lovely to have them, but I felt like when it was necessary, I don't want the same mom at 42 having to be the same mom I rely on at 62. So I just wanted to keep going and pushing my limit, and boy did I push. So I I may have over pushed it and just felt like, oh wow. And that's what with the thing where it came with, oh, you're so strong. And then that started backfiring, because now I had built myself to this person where, oh, I could do this and I could do that having to ask for help started sounding weird to me, because I was the overperformer. I was the person who was getting stuff done. So it was like a whole hitting ground level and like trying to rewire my mind, which is why till date, the first symposium I ever held was um, coping mechanisms with sickle cell, the learning and unlearning. I realized that those mechanisms had helped me at the time, but how was it hurting me now? So I had to let go of a lot of them, and I had to start learning new ones. Like I talk about it on my page, don't drive yourself to the hospital. That is something that was really bad that I used to do, and I thought that showed my strength. No, that showed how risky, and I wasn't thinking. So I had to start consciously telling myself, where am I drawing the line to say this is unhealthy and this is healthy? So it's like having to come to this place where, like I said, I'm emerging in this strength. This is why now, if you tell me you're strong, I'm sorry, that's not the compliment you think it's supposed to be. Like, my mom had to literally see me and say, being a strong woman is not really it. Like, be soft, ask for help, allow yourself to be helped. And it was just a really good evolving process. So still emerging, still learning, and I'm
No,
here.
that's great, because I hear a lot of myself in you, and some of my friends that are on this chat, they'll say that I'm always like, I don't need help, like I'm good, I'm fine, and hence the conversation, I'm okay, right? Because as an individual living with sickle cell, it's like you don't want anybody to see you as weak. You don't want anybody to see you as less than, or like you can't do it, or you're using your chronic illness as a crutch, right? And so because of that, you end up overcompensating to where you end up putting yourself into a crisis. And when you do get in that crisis, it's like, okay, I don't want to go back and try to ask somebody for help. I can push through this because I don't want them to have to worry about me, right? So now it's like you're worried about them on top of having to like worry about yourself in the midst of that. And so now you have that like dichotomy of like, okay, how do I handle this? And so the best thing is finding strength in that weakness, right? And so being able to it's okay to say I need help. And so I feel like as you get older, you start to really truly understand how to let people know, and I'm still working on that. So but how to let people know, like,
Definitely.
I do need your help, right? And so we're still at a place where we're trying to like come into that and learn that. So I like that you shared that. So I'm gonna let Christina go, because I like how you talked about the person I am and your help from your mother at 30 versus 65. So Elle, you know, we're coming to you.
Yes. But I do want to pause and say a couple of things. First of all, thank you for our viewers who are watching. This is a live conversation. So I do want to invite you, if you have any questions that come up for our panelists, please feel free to go ahead and put those in the chat, and we'll get to those later on today. So thank you for the comments and all that so that we know you're there. Appreciate it. Another thing I realized is that you probably know about Ijoma. She's an individual living with sickle cell, but I didn't really introduce myself. So I'm Christina Scott, and the way that I'm connected to sickle cell is that I grew up with a sister living with sickle cell. When I was first tested at 3 years old, they told me I didn't have the trait, nothing. When I was tested again in my 20s, they told me I had the trait. So I didn't find out I had sickle cell trait until I was in my 20s. But I grew up kind of as a person who kind of experienced sickle cell through my sister, and also sometimes as a caregiver myself. So I really appreciate you being on here, because I can kind of relate to the space of caregiving. So I do have a question for you, Elle. How does being a caregiver to someone with sickle cell impact your mental and emotional health? How's that shown up for you?
So, first and foremost, I struggled with the diagnosis, and that was feelings of guilt. Sickle cell disease is a genetic disorder. So, that means that my husband and I, we met in college. We didn't know we had the sickle cell trait. So, I hadn't even heard the term sickle cell trait. And I think that's unfortunate. I pride myself in being a lifelong learner, and I felt like I was blindsided. And so at first, I really had to learn how to let go of the guilt. So for me, as a person of faith, that meant with prayer and, being honest with myself that it wasn't something that I could change. But now that I have this information about my daughter as a caregiver, what will I do next? And so for me, it was nothing I could do that would have prevented my daughter to have sickle cell, because I truly didn't know. And so I've taken my pain and I've put that into my advocacy. So for me, it's one of those things where when I'm interacting with my daughter, I have to think about the present and not the past. And so I think that is the biggest hurdle that I face. And many caregivers, I'm sure, it's not something we really want to admit, but I think it is truth to the guilt aspect and learning how to literally let it go and release yourself from that and live in the moment.
Yeah, no, that's good, because me and Christina were talking to a friend of mine yesterday. And so she was talking about how she found out that she had sickle cell trait when she was pregnant with her son. And so she said she didn't know. So she was like, okay, are my parents lying because they said they don't know? Or is the doctor lying? Because she's like, how did I get this? Because my parents both say that neither of them have the trait. Not understand that, like, people didn't talk about this. It was never a conversation that was had. And so going back to the stigma behind sickle cell, and with that, people don't share. So you don't know. Even when I became a bigger advocate for sickle cell, I didn't know anybody living with sickle cell outside of my immediate family. Like, I have a younger sister and a twin brother that both had sickle cell, but I didn't meet anybody else with sickle cell until after college, when a friend of mine that went to college with another young lady who's the reason I started the Ruby Ball, Ebony Lanier, she passed away in 2017, but she was the first individual I ever met that also had sickle cell. And so it's something that we don't talk about. And so that's why I'm glad that we're able to have conversations like this, so that we can be more vocal, and those individuals living with sickle cell or that even have the trait don't feel like it's something to be ashamed of. And so with that, I wanted to move on to Maya. And so we always talk about the physical impacts of sickle cell from the perspective of pain. How do you see emotional and mental impacts of sickle cell with your patients?
Sure. I mean, I think it's so important to address, and I think it's hard because there's a national shortage of sickle cell specialists. So a lot of patients are just going to get connected to a hem-onc doctor who does primarily oncology and really is only going to focus on the pain and the anemia of sickle cell, where mental health, I mean, when it comes to anything, you need to treat the mind, body, and soul and head to toe of a person, because we know negative mental health is negatively going to affect physical health. We have plenty of research specific to sickle cell and specific to depression and anxiety for more intense pain, using more narcotics, more times in the hospital. So as part of my evaluation of every patient in a clinic appointment, you can kind of feel out and can tell from a person's mood how they're doing, and kind of ask the right questions and probe further, because I think it's really important to address mental health and make a lot of people realize that you're not alone in this. I think everyone thinks that there's such a unicorn and the only one dealing with the problems that they're having, when I think when you normalize it and validate that 15 to 35% of patients with sickle cell are going to have anxiety and depression, and normalize it, they feel a little bit more comfortable. And I think just putting the connection that mental health is negatively impacting your physical health, I don't think that you can just blame mental health alone for all of the problems, because when you're having pain, whether it's from mental stress, physical stress, and infection, regardless, we still have to treat it. But I think just making patients aware how mental health really does interplay with physical health is important. So I have patients on the whole spectrum. I think mental health is a spectrum. It's not just having depression. I deal with my own anxiety. I have depressive symptoms too, and I have great days. I have not so great days. And again, just normalizing this with patients and making you realize that you're not alone in this and not suffer in silence is the most important thing that I can do as a provider. And if it's a matter of connecting you to a therapist because you want to seek professional support, I'm going to do that. If it's a matter of connecting you to Sparkle for Sickle Cell or other different advocacy groups, because I think on social media, it's so amazing how we've been able to connect with people. Mm-hmm. And again, I think in Africa and in other populations, mental health is viewed as a weakness. So depending who you talk to, if you speak to your parents, you just need to pray more. And that is just so harmful to do for a person, because I'm praying as hard as I can and I'm still having mental health issues. What's wrong with me? And you're internalizing it. And then you think something's wrong with you. And then you're just adding another layer of mental health issues. So I think words are just very important. And I think normalizing that it's not a form of weakness. And the power of prayer is very powerful, but sometimes that alone is not enough. So I see full range with PTSD from just medical trauma. I mean, medical trauma is not discussed enough, but imagine PTSD just from a poor hospital experience, or you might have PTSD from one of your kids having a terrible hospital experience and feeling hopeless. So we focus so much on the warriors, but caregivers, we see a lot of mental health issues as well. So I think as providers, we need to cover the anxiety, the depression, the PTSD, medical trauma, and all of these things that could be interplaying with a person's health.
Yeah, no, that's really, and I know you mentioned a little bit, just like we need to normalize talking about our mental health and know, like, everybody, it doesn't necessarily mean that, oh, I'm depressed or I'm dealing with, schizophrenia, different, things like that. There's spectrums of mental health. And so just even as you said that, like dealing with anxiety, a lot of us deal with anxiety in different forms or different ways. And so just even touching on that, like, how would you say, as a healthcare provider who regularly sees patients with chronic illness, how does that impact you sometimes mentally, being able to show up for your patients and be there for them in the midst of what they're dealing with?
And I'd like to hear that from Erica as well, too, like how regularly seeing patients with chronic illnesses impact you as well. So Maya, you first.
I mean, it's heavy. It's hard. I deal with my own mental health issues. And again, it's on a spectrum. So I am the first one to admit I go to a therapist. And I think it's the most amazing thing, because you have somebody who's non-biased to kind of just help you sort through your thoughts, give you different perspective, and kind of realize what is causing you to be triggered. So I am the number one person to advocate for a therapist, just because I've had such my positive experience myself. But on the provider side, I mean, with sickle cell, it's so unpredictable. This time last year, over a 2-week time period, I had 3 patients pass away with sickle cell. The first one was a 34-year-old with 3 kids herself. So as a mom myself, I can't help but put myself in her position. The other one, we weren't consulted on the admission, so you can't help but just replay, could have we done something different? Then the third one was somebody with a lot of complications, but even though he had complications, it didn't make it any easier, because I still remember making that last visit in the hospital and just having it was very difficult, because I'm like, is he going to know that I'm coming to see him specifically, because I know this is the last time? And I cried pretty much every single day going home for a 2-week time period. And I think that's pushing me to advocate even more from the provider side of things, because yes, I'm fighting so my patients and all sickle cell warriors get the attitude and the care and the treatment that they deserve. But it's also important to realize that as healthcare providers, we are impacted as well, that we shouldn't be the ones who are just making this harder for patients and not believing them and making them prove. We really need to understand how that stress is going to negatively impact their pain even more, especially when they're in the hospital presenting with a severe crisis. That doubting and questioning them is just going to worsen the whole process. So mental health, I mean, I'm so glad we're talking about this, because I don't think it's discussed enough. And there's so many implications from a chronic health standpoint, because negative mental health can pretty much cause so much. And I think when it comes to chronic pain, we see very high rates of depression and anxiety as well. So just understanding that it's not you and it's just the situation, and knowing when is the right time to ask for help is important.
Nice. So Erica, we'll head over to you.
Yeah, I think I'm going to second a lot of what Maya already said. I'm very open about being a therapist who also goes to therapy. I think normalizing it, especially as a Black person, Black woman in this community, there is such a stigma against mental health and seeking support. And I grew up in a faith-filled family, and I think there's even been some conversations that have had to happen. It's like, you know, if you're a person who believes in God, can you also believe that God created therapy? God created mental health practitioners, right? And so like can both be true at the same time. And so this is not like a disrespect to your faith. It's an addition to, and you can even find a practitioner who is part of your faith system if that's very important to you. But, you know, I really normalize, like I'm a therapist who goes to therapy. There have been times where I'm a therapist who's also taking medication for my own mental health stuff because I'm in a worse position. And if I'm not taking care of myself, I can't show up well to work. And that's not a healthy dynamic or healthy relationship. And I think also with the specialties that I have, you know, it's important for me to be able to recognize, like, as much as I want to say I leave work at work and then I drive home and it's a separate space, it's not. I would love to be able to turn that switch on and off, but it's really not true, especially when, like, a lot of times the person sitting across from me is dealing with some of the same things that I'm dealing with, living with a chronic disease that maybe is the same, maybe is different, but also recognizing like the implications of what happens to my own body when I'm stressed. And so supporting clients and recognizing the importance, like, oh my goodness, I love what has been said here about like this idea of being strong and and sometimes being strong means being strong enough to ask for help. I think that's such a different reframe for a lot of the way we were raised, to be able to take care of ourselves, our families. I'm also an oldest child, so I'm the oldest of 5. And I think the other thing that I like to remind people is that, you know, when you're living with chronic illness, that's its own mental health trauma. But you living with chronic illness does not stop your life from happening. So in my own story, like I was diagnosed in 2003. At the end of that year, my dad died in a car accident. And I was still figuring out how to live with chronic illness. And my mom has 5 children by herself. And so a lot of times, a lot of my clients are going through these experiences where you've been diagnosed with a chronic disease or you're living with a chronic disease and you've got the trauma of that, but that doesn't stop the rest of your life from happening. Yeah. You have these things that are compounding. And like Maya said, like it's adding on stress to your body, which is adding on stress to your symptoms, which is making your symptoms worse, which is then stressing you out more, which is then making the rest of your life stressful. And it's this endless cycle. And if we don't have the skills or the resources to support our mental health in this process, it really is just like this growing ball of trauma that just gets out of hand, even more so than our unpredictable illnesses already are.
Yeah, so just you saying that, talking about coping mechanisms, is there, if there's someone listening with chronic illness, or that's living with sickle cell, or just even dealing with mental health in general, what are some coping mechanisms that you would recommend?
Yeah, so one of the first ones is support. And that can be really lots of different things. I used to make such fun of people who had dogs and were like dog people. And I was like, why are they so into these animals? And then I rescued my dog Toast, and you can't tell me nothing. Toast is the best dog in the whole world. She can do no wrong. And I'm still like, she doesn't sleep with me. There's nothing against that, but I'm like, I do still have some boundaries. Like my dog sleeps on the floor. But like she's been so helpful to just have, like, I have to take her on walks, even when I'm not feeling good. And sometimes I do have to ask for help, but I have to take her on walks, which means I have to move my body at the capacity that I move it. But I also have a very chill, lazy dog. So we're not like hiking or running or anything like that. Right. I have my friends, and part of that, I didn't tell anybody that I had lupus for a long time. Like my family knew, and I just didn't tell people because I didn't want to be treated differently, which was such a disservice. In high school, I would disappear for weeks and then I would come back and people would be like, "Where'd you go?" And I was like, "Oh, that was literally my response." And people were just like, because I didn't want to be treated differently. And so part of it was being open enough to like ask for support, let people know what you need. But, even that is within like the people that I trust in my community that's been there for me, that's helpful. And that support might be your church, it might be your friend group, it might be your family, hopefully. Maybe a lot of my clients have all sorts of pets. Some of them I'm like, no, please don't show me your snake. My clients have all kinds of pets that are resources for them. Sometimes it's social groups. So I would say like support community is so important, but also what are things that bring you joy? And because finding these bits of release, whatever they may be, and I always say, one of my favorite things to do, I was doing this before this to calm down because I get sometimes sort of anxious, was I was watching the show called Criminal Minds, which is all about murderers. And why that's relaxing to me, I don't know, but I love it, right? So what are things that bring you joy, that help you calm down? Maybe it's watching weird TV. Maybe I also love to bake. I like to take naps. Like, what are these things that bring you joy? They don't have to cost money. They don't have to be like, I would love to go to Hawaii every time I was stressed out, but that's not realistic. So what are things that bring you joy, that maybe make you laugh? So my clients and I, we make music playlists of songs that make you feel better. We make meme playlists, Instagram folders of just funny things. Like, what are these things that bring you joy that are really easily accessible, along with like somatic interventions, like breathing, stretching, movement that might feel comfortable, that can be really helpful releases. But I think sometimes people say coping skills and self-care, and they think I need to spend all this money on a massage, I need to Peloton, I do all of these things, which, I mean, if you have the money, like, great. But I don't necessarily have Peloton money every Tuesday, but sometimes I do have like, Bojangles money. Like, I really like Bojangles. Do I need to eat it all the time? No, but
okay, Carolinas.
And so what are these things, these resources that bring you joy? What are community that you can lean on for support, whatever that might look like? Are probably the two big things I start folks with, because I think they're really accessible and they're often free. And I think that's really important, because for living with chronic illness, there's probably some financial stress from the medical systems that we have, the medicines that we're paying for, the time off of work that we might have to take because we're not feeling good. And so adding more financial stress to someone who's probably already dealing with financial stress is just more stressful. So what are some resources that we can access and create that are already within our systems and our lives?
Can I add one thing just from personal experience that's really helped me? And again, when I have a good personal experience, I'm always fast to recommend to patients as well. But my therapist had recommended me practice mindfulness for my anxiety symptoms. And it sounds easy. It's essentially a form of meditation where you can just accept your feelings, your thoughts, and everything in a non-judgmental way. And I'm the type of person, when I'm not good at it, I just want to like keep at it until I'm really good. And I never realized how hard meditation is. But I've never realized how amazing you can feel afterwards too. So that's something that's free. I would say practice it while you're feeling well. So that way, when you're not feeling well, you already kind of have the skills to implement, because I had my first back pain flare up in several months, and just being able to use a lot of the techniques that I've learned through mindfulness and guided meditation has really helped me through. So just in case anyone wants to check that out.
And speaking of free, and speaking of mindfulness, thank you for bringing that up. I think on Saturday, at 11 o'clock Eastern Standard Time, we are actually hosting a yoga and mindfulness Zoom session, and it's free for anyone who wants to join. So it's a great opportunity for, as Erica, as you mentioned, being proactive about mental health. So please join us. It will be a Zoom, and the link is somewhere on one of our pages. On our Instagram, we have we've posted that, so that's definitely it was a good plug. Thanks for that.
I didn't even realize I did that, but when you posted it on your post, I'm like, these are like two of my favorite things. How great is this?
Yeah, so I wanted to circle back on something that Erica touched on, and Jerry and Emeka, y'all also touched on this as well, where we talk about that feeling of needing to be strong, not letting people know what's happening or what's going on, and that goes back to the silence piece of it when it comes to having chronic illness and not wanting to talk about it. Like how you even said that people was like, where have you been? I was like, oh, I've been gone. So it's like, what are some of the things that we can do to become more vocal, to empower the Black community? Because I feel that that's something that's very prevalent in the Black community, is not wanting to talk about things because we don't want people to look at us or perceive us in a certain way. So how do you feel that being vocal can help us to empower the Black community and remove that stigma that's associated with chronic illness? And so I'm going to put this out to oral warriors, whichever wants to answer.
Jerry, I'll let you go first.
Okay. No worries. When it comes to that within the Black community, for me personally, I'm, as you were saying it, I was comparing it to financial literacy. If you don't continue to talk about it and you don't continue to familiarize the community about it and let them know all the truths and the myths and the facts behind the actual topic, and put all the myths to rest, then I mean, people don't know, what they don't know. And so when it comes with sickle cell, I just think the conversation has to continue to be a vocal one. It's very good that young advocates such as ourselves and health professionals are here. We're able to have this very diverse conversation, but I continue to play my part in this whole giant plan. I don't know what the whole entire giant plan is for sickle cell, but my personal plan is to continue to speak about it. I was hearing a lot of the earlier answers, and it felt right in line with me when I was in school. Even I think you spoke about it yourself, Ijoma. Like I was the only individual with sickle cell. I was the only warrior that I knew growing up in grade school with sickle cell until I got to college and even graduated. And that's when I saw this whole new world of other warriors. And then I realized that, man, okay, my life isn't as bad, or my case isn't as bad. And so I said, so for me, it was like, okay, people don't know about these opportunities, about the different organization support groups that there are in each of our local cities. And if we just continue to speak, continue to stretch our hand, you never know who's going to pop in. You never know who's going to, like, through my whole journey, Instagram has been, social media has been very great on my platform in the sense that, of course, I can connect with people from thousands of miles away. And all I have to do is just put a little note on my feed. And I mean, I'm reaching somebody from thousands of miles away. And that might be about a conversation that they would never have had if they were within their circle, amongst their friends, amongst their group, where they're currently at in regards to knowing that sickle cell, that's something that's very predominant in our community. And it causes a lot of pain to individuals who are diagnosed with it. And we need to understand the symptoms, the stigmas behind it. We need to encourage everybody to continue to get support, because sickle cell isn't the only thing out there, or the only blood disorder or any disorder that's out there. Everybody's going through something. That's what I kind of realized at my age now, is everybody's going through something. And so it's like, hey, sickle cell is not that bad at all. So I just continue to try to encourage the conversation about sickle cell, just continue to get it out there in the Black community or in the African American community. Just continue to keep sharing the message. The more that word gets out there, the less it becomes, I guess, how do we say in our community, wicked word or something that we rebuke and things of that nature. Like, we just want it to no longer be looked at as evil. Like, it's just, hey, it's just something that I have. I'm no different than the rest of the person. I'm moving just along. So
nice. So I was going to say, did you want to add anything onto that?
I like that he touched on talking about it, because also why I wanted him to go first is, like you said, talk on the Black aspect in the environment that he's in. I'm in a predominantly Black, we're all Black. So it's like, for example, also when he talked about dispelling the myths, like that's what I've been trying to do all my life, because there were just too many that weren't very helpful. Like, I'm literally crazy when I go about my birthdays. I go so hard because I just remember like 16 was where I was thinking, oh, this is when I go to meet my maker, because just somebody had told me that. So like things like that. And then I had put up one on my page recently when they said when you grow older it stops, because I have literally family, people walk up to me and be like, you're past 30, why are you still sick? I don't know that. So it's like when I hear questions like this, I'm like, that's not something to say. And I put it on my page. And then that's why I said I like to have the difficult conversations. I've gotten over it. I've gotten over the name calling, what you think I am. Okay, fine. Let's come to the table. We still have to talk about it. So when I put up questions about saying stuff like, there's nothing like saying after 30, your crisis stop or it gets less or anything, because now what do I have? I have people comment about things like, oh, that might be true. And I'm like, yeah, it might be true for one person, but let's talk about the negative part of driving such a narrative. Because in the end, if 30% of us agree one thing is something, what are we doing to the other 7%, 70%? We're harming the rest of them. We need to understand that this disease affects each of us individually differently, right? We're all individuals, unique, and it's not what works for A works for B. What works for Jerry that he takes would probably finish me. So these are the conversations that I think we need to have, and it saddens my heart because I'm trying to have a live where we talk about like who people who didn't know they had sickle cell like late into their teens or early 20s. And I had people flooding my box because they could relate. And I was like, these are the conversations I want to have. I want to speak to these people to tell the rest of the world that I was clueless. And then one day my life literally blew up in my face. Imagine having a crash course in something that you never knew about. So when I have these conversations, I've had people come to say, because you did this, I can do this. It breaks my heart for people to say, I'm hiding stuff from my friends. I'm hiding stuff from people at my work, my church, just because I don't want people to think of me in a certain way or look at me in a certain way. So like he said, it's just talking about it. Honestly, I was trying to just be low key and find out other people like me. And like, you know, when you just have that buddy where you guys like talk about your struggles together and then this thing is blowing up, I'm like, I'm not equipped. But the thing is, the more you do talk about it, you're learning. I have Maya now, who some days I'll be like, Maya, this doesn't make sense. What do you think? And she'll be able to feed me the kind of information I need. I could swap notes with Ijoma and say, does this happen to you like this? This doesn't happen to you like this, so that I can form a better opinion of something. So I feel when I keep talking about it, some girl somewhere, some boy who said I didn't talk about it will be like, I feel braver to be able to come out and say, this is who I am, because they see me saying that and they be like, look, she's living. The fact that she came out and said that didn't discredit other things that I am, the other things that I keep becoming every day. So I think that was what I wanted to add.
Nice. And so you said a lot of things that we'll probably unpack in another podcast episode, because we need to go. But just even what you said about like the life expectancy of somebody living with sickle cell, because I had an uncle that told my mom when my sister was in the hospital, oh, I thought they already cured people of sickle cell. She's still in the hospital. You know what I mean? She's still going to hospital for that. And it's just like the ignorance of, and it's like, it's not, they just don't know, right? So it's not that they're just necessarily ignorant, they just honestly do not know. And this, even what you touched on in terms of everybody presents differently in terms of how sickle cell is. So we always talk about this universal cure for sickle cell, but it's like I've come to the realization that I feel that there's different therapies and different things that work for different people. And so being able to really truly understand that, so we can touch on that. But I wanted to go to Elle and then come back to you, Maya, because I wanted to talk about it from a healthcare provider perspective and like sharing back with your colleagues. But Elle, as you hear Jerry and Amake, yes, speaking about their stories, thinking about your daughter and how things have changed from them growing up to like where you are with your daughter now and seeing her come up as an individual living with sickle cell. What are your thoughts on that, and what did you want to share?
So for me, I wanted to really help people understand, and it started with my kids. My daughter's physician recommended that I homeschool them. And so it's from my experience teaching my children. So I have twins. One has sickle cell and the other has sickle cell trait. And so I knew that I had to help both of my children understand what was happening and how the body works. So that's really why I started to write children's books, because people sometimes won't learn for themselves, but they'll get a book for their child. They'll get a book for the class or something like that. And so for me, I found teaching children as a way to open up the Black community and have conversations that are difficult, because when you break down the science so that even a child could understand, people seem to be more receptive. And so for me, it's been a way for me to go into the community. I know that, you know, a lot of people don't necessarily say, oh, I have sickle cell. But what happens to me when I go into the community with my children's books, people often say, I had a roommate who had it. I had a cousin. I worked with someone. It begins to open up conversations that we never had before. And so I think, you know, each one of us on this podcast, we all have a role. And for me, I learned that my role was through writing, through connecting with people through words. And so I'm able to kind of have an impact on my community outside of just the sickle cell community and say, look, you know, Black people as a whole are, you know, people even who are not Black, because when I travel and I talk about being a caregiver, I get to hear from people who have all different types of backgrounds and different demographics who also experience sickle cell disease. And so it has caused me to have a greater voice and to be able to have these conversations, because it's planting a seed. So no one's going to understand everything you say, but the next time someone has a conversation with them, they'll have something to build upon. And it really helps deepen that impression and increase their knowledge.
Thank you so much. So we had a question that was in the chat around being seen as drug seeking. And that was kind of going to the question that we wanted to talk to you about, Maya, because I know we're getting towards the end, but no, hearing those stories of your patients living with chronic pain and not being believed by their providers, what would you share with your colleagues in terms of supporting their patients living with chronic illness so that they can better be better providers and better support them through this journey? And so I also wanted to touch on, I know we talked about the whole concept of health disparities, and so how that like ties back to that as well. So if you could touch on that a little bit.
Sure. I mean, I think we can all agree that we live in an environment that has very little support for people living with chronic illness. And I mean, it's a very discriminatory climate for people with chronic pain and chronic disease, and especially so, even more challenging for people of color. I mean, I can't tell you how many calls I've gotten. Oh, well, your patient's listening to music, or they're laughing on the phone, or their labs are normal. And at the end of the day, it all boils down to a provider's implicit bias. And I think just calling it as it is, and Amokia, you talk about having those uncomfortable conversations. I'm doing the same exact thing on the provider side, because we need to call out and have these uncomfortable conversations. I mean, you think about sickle cell and the major psychological burden that so many warriors carry, considering that the majority of patients are suffering in silence at home in order to avoid the judgment and the mistreatment in the hospital. Then they finally get to the hospital and have to prove being deserving in pain. And that stress is just going to worsen it. I mean, we know the effects of pain. I can speak nicely, but when I'm having a flare up, I mean, that's out the door. So you can only imagine the type of stress that it has. And I don't think there's any other disease or condition that is dealing with this to that degree that makes you kind of look at it and boil down that it is a huge racial disparity. I mean, I always say that sickle cell is the greatest health and racial disparity seen in medicine. And it's because you hear literally horror stories from everyone. So I think on the provider side, it's more just continuing to have the conversation, continuing to educate that there's more to sickle cell beyond pain, really describing the complications from head to toe that can happen, because it's more than pain. Labs don't tell you about pain. We need to remember that pain is an individual experience and it's different for everybody. So everybody's kind of been touching on that, how we need to just treat everybody as an individual. So I think on the provider end, it's just continuing to have those uncomfortable conversations and to kindly just continue to advocate for our patients. And what I do is when my patients discharge from the hospital, we're like, oh, go to the floor and visit the staff, because you're not your best self when you're in the hospital. And these are the opinions that people are judging you from, that come in when you're feeling well, and show them how bright and sparkling and amazing of a person that you are, and show these people that they have such a different and distorted perception of what sickle cell is. Because I think when you meet, I have several patients who are nurses or who work within the hospital setting, and when they tell their coworkers, hey, I have sickle cell, all of a sudden already had a friendship with this colleague and you find out they have sickle cell, that's automatically going to now change that provider's perception for the next patient with sickle cell that they care for. So I think patients need to lead with their diagnosis and not be ashamed of it, and just normalize it among everybody around, because lack of awareness is a huge problem. And I think providers really need to do a good job self-reflecting and thinking how I went to a Jewish day school and I lived in a bubble my entire life until I went to college. And that's when I was exposed to everything. And you have to have the integrity to realize what you do and what you don't know, and just lead with your heart and be compassionate and treat people and others kindly. I think outside of medical, just in general, we just need to be kind and compassionate. And one act of good that everyone does, cumulative, is going to have a bigger effect for the greater good. That we just need to keep talking, keep educating, keep spreading awareness. And I think there's a lot of next generation healthcare providers who are specifically getting into the medical field because of poor experiences that they've had, that they want to make a difference. Erica, I'm not sure if this led you into the medical field at all, just with your diagnosis and whatnot, but I think it's going to be an uphill battle. But I think we are slowly starting to see change, and it's going to continue to come, but we need to definitely unite forces.
Awesome.
Yeah. And there's some other comments in here from healthcare providers that are listening. Natalie says, "This is so beautiful and informative. As a healthcare provider or professional, I'm learning so much hearing about all of your personal experiences that were cut off." And then someone else, also a healthcare provider, Charlene, said, "From someone who just graduated nursing school, sickle cell is not educated enough." So that's
it's
really...
one paragraph. I always say everything I learn about sickle cell is from my patients and working in the specialty, because nursing school,
but yeah, so
you might get a chapter or a couple pages, but nursing school, it's very minimal.
Yeah, so we are at the top of the hour. So before we close out, if you could just share what would you want people to get out of this conversation as we close, and then if you can also share how people can get in contact with you if they want more information or they want to come to your social media to learn more about you, learn about your story, sickle cell, how to just be able to support those individuals that they may know in their lives that are living with chronic illness.
I guess I can go first, and I'll let the warriors finish. But I think the most important thing is to realize you're not alone and don't suffer in silence. It's okay to ask for help, set boundaries, because your mental health is more important than other people's perceptions of who you are. So I think once you realize what you can and can't control, you're one step closer to improving your mental health. And if you want to follow me, my Instagram is @TheHemeNP. My DMs are always open. I can't provide medical advice, but I always like to just share my expertise if you have any medically related questions or if you have any topics of interest. So thank you.
And her reels are on point.
I don't take myself too seriously, but I take sickle cell seriously. So just a warning if you see me act crazy.
And I guess I would second that. Like, your mental health is so important. So it is okay to ask for help. It is okay to get support. It is okay to find a way to take a break. I realize that's sometimes really hard to do depending on our life circumstances, but sometimes that break, my mom used to go to her room and she'd be like, "Erica, give me 10 minutes." And she would go to her room and I would entertain everybody. And that was some of the breaks that she could take as a single mom of 5 kids. So figuring out, like, what does it mean to take a break for yourself, to give yourself that space. And, I would just say, like, communicate, tell people who you trust what you need, who you trust being imperative, because I recognize not all people are the same, but that community can be so supportive. And if you want to connect with me, my social media is Whole Mentality. I love connecting with people. My DMs are open. I cannot diagnose you or provide any clinical advice via Instagram, but I do have resources to support people in finding therapists that are good fits for them. So thank y'all for letting me be here tonight.
I love the caveats from the medical professionals.
Yes.
I cannot provide medical advice.
So, Elle, we're going to go to you and we're going to close out with our warriors. What would you like to share?
Sure. So I just want all the parents to know that the only way for you to take care of your children is if you take care of yourself. And for the longest time, I was doing everything I could for my daughters and not going to my own doctor's appointments. So you have to put that same attention on yourself, because you won't be here to care for your loved ones if you don't take care of you. So make therapy a priority, make going to your own doctor's appointments a priority, and learn what makes you happy. You have to find moments of joy. It's been talked about in this conversation, and I'm so grateful to have an opportunity to share with other caregivers. So, November 4th through the 6th, I actually co host a caregiver summit. And so it's not just something I talk about randomly, it's something that I've committed myself to do. So if you want to join us virtually, go to scdcaregivers.org and you can find out more about our Caregiver Summit and sign up for the mailing list so that you can find out when registration is open. It's a virtual summit where we educate people. We also give you tools to help you on this journey because you don't have to do it alone. We've been there doing it, and we're willing to be able to support you on this journey as well.
Awesome. Thank you. And so as we close out, coming to my fellow warriors and advocates, so what would you say are ways that people can support members, family members, and friends can support you as through your journey with sickle cell? So what would you want to share with them on ways that they can help to support?
So I'll go. I'm in active therapy, so I like to share that on here. It has been very helpful, and my therapist actually suggested something that was very helpful, which is she said I should develop a crisis support structure. And what that means is when you're well, go around to family members that you trust and be like, you're in charge of food, you're in charge of the medication, you're in charge of rubbing my back, you're in charge of driving me to the hospital. Like, just literally let everyone know how you will need them in what capacity, but because you don't want the cousin who comes in and is crying everywhere being the one to give you food. You're like, you're crying, I can't eat. So you want to be able to let people know what are the things you admire about them. I admire how you pray for me when I'm sick. So this is something that I'm working on, not yet like solid, but it's something that I've learned to work on. But I'm also saying for other people, I tell people, don't ask me what I need when I'm sick. Ask me what I need when I'm well. Like, I think I'm in a better mind frame to be like, okay, this is how it is. But when I'm in pain, my tone is off, everything is jumbled. It might not really be the best time for me to be able to provide that. And for other ways that you could support a family, a warrior, you could also find a lot of tools on my page. Those are actually stuff that I have discovered going along with my sickle cell journey. So just visit Sparkle for Sickle Cell. They're very bold carousels there with exactly what you need and how you need and when you need it. So I feel like that will give you guys like more perspective to be able to understand that. So that's it for me.
Awesome. Thanks. And we're going to close out with you, Jerry. Thanks for sticking with us.
It's been a great panel conversation. I guess just to kind of wrap things up on my end, I just kind of encourage everybody that sickle cell is still a conversation. That's something that we need to continue to maintain the baseline of. It's a conversation that we're still barely having at this infant stage. I still think we have a long way to go. And of course, as we're noticing now, and it seems like every panel that I do, I'm noticing that everybody's still learning something about sickle cell, and as we discussed amongst our panel. So we still need to continue to maintain the conversation. When it comes to sickle cell, I kind of say how to support. I think since sickle cell is kind of noted, is recognized as a predominantly Black disease of the sort, I kind of encourage everybody in the African American community to really try to take it upon themselves to say, look, we want this information to be understood amongst our community, not to be something that should be shamed or slandered, but hey, we want to push and support each other. I think we do too much of trying to knock each other down in comparison to other races and other communities. And so I think this is an opportunity where we can get behind each other and say, no, we're rooting for you. And I want us to continue to do that. I think as the generations go, I think our community is becoming more towards that direction. But when it comes to some of this health, our healthcare, this situation right now, or this disorder, is that I do want us to continue to encourage each other to push and support each other and be there for each other as much as we can. because that'll go a long way for our progress as a community all together. You can follow me at most of my social medias are at _ I am Jerry N. That'd be TikTok, that'd be Twitter, that'd be Instagram, and be some very crazy active stuff on my feed though. So, I try to live my life to the fullest.
Warning.
I try to live my life to the fullest. So you'll kind of be like, you have sickle cell? And yeah, man, you just gotta live. You can't live like, you don't want to enjoy some things. I don't want to live with no regrets. So, I'm still enjoying, and my life is very active. It's very, very thrilling. And so, yeah, you can follow me there. You can see a lot of the things that I do. Of course, I'm still an avid supporter of sickle cell. Even my support group, community-based organization, Sickle Cell Association of Houston, we are hosting a walk, one of our annual walk, our 7th annual sickle cell walk, here at McGregor Park in Houston, Texas, on the 17th, next Saturday. We're doing a virtual walk that's already started from September 1st till October 31st, I believe. And we're taking donations to support the cause, or we're also asking people to come out, support, walk with the community. This is a standalone organization. It's not with the Mark Thomas Group. So Sickle Cell Association of Houston. You can check us out, sicklecellassociationofhouston.org. And you can check out some of the things that we're doing in the community. We continue to raise awareness and just kind of continue to build community and build support amongst each other.
Awesome. Thank y'all so much. And thank you for spending your night with us on this Monday, because I know that you're tired from work. And then, okay, what time is it in Nigeria right now?
It's 11 past 1 a.m.
Okay, yeah. So we're going to let her get to bed. But thank you all for joining us in this conversation. We truly appreciate it. If you're not already following us on social media, we are the Ruby Ball. Both on Facebook, on Instagram, and you can also find us at the Ruby Ball Foundation on LinkedIn. So thank you all for joining the conversation, and we will talk with you soon.
Thank you.
Thank you. Bye-bye.
Bye, everyone.
Bye.